you want to learn the X-ray, CT scan, MRI, ultrasound like a pro, then this is a must-have book for you. And I'm going to give a short review of this book. The name of the book is The Unofficial Guide to Radiology, which includes, we will see the contents of this book to see what it contains. First of all, there is an introduction in which introduction of the different radiological modalities is given, like what is X-ray, what are the indications, benefits. Then there is a section of chest X-ray, in which after introduction of the chest X-ray there are 20 clinical cases discussed. We will see a few of them to assess that what is the methodology used to present the clinical cases. Then there is the section of the abdominal X-rays, which also contains introduction and 20 clinical cases. Then comes the orthopedic X-rays, which after introduction involves spine X-ray cases, shoulder X-ray cases, elbow X-ray cases, wrist X-ray cases, hip X-ray cases, knee X-ray cases, tibia fibula X-ray cases, and ankle X-ray cases. CT scans include CT scan of the head, CT scan of the cervical spine, CT scan in orthopedics, CT scan of the chest, CT scan abdomen and pelvis. Then comes the section of MRI scans, which includes MRI of the head, spine, MRCP, MRI small bowel, MRI knee and other joints. Ultrasound scan section includes neck ultrasound, chest ultrasound, abdominal ultrasound, pelvic ultrasound, fast scanning, vascular ultrasonography, musculoskeletal ultrasonography, ultrasound guided procedures. Nuclear medicine scans include VQ scan, MI perfusion scan, genitourinary scan, bone imaging, pattern CT scan. Then comes the section of fluoroscopy, which includes contrast swallow, barium follow through, contrast enema, tubogram, and there are the bonus cases of chest X-ray, advanced chest X-ray, bonus abdominal X-rays, advanced abdominal X-rays, bonus orthopedic X-rays, and advanced orthopedic X-rays for practice. And interpretation of each modality is also given. First of all, there is an introduction of the X-ray, as we have discussed earlier. Then comes the section of chest X-ray, in which first of all there is the introduction of the X-rays, that how to interpret the chest X-ray, what we have to look, and what is the normal and abnormal findings while assessing the chest X-ray is given. Then after discussing that, multiple clinical cases of the chest X-ray are discussed. Different clinical conditions presenting on the chest X-ray are the points are discussed in summarized form, and then here starts the section of clinical case. A scenario is given. You have to read the scenario, and the relative investigation is given along with the scenario. For example, the relative investigation in this scenario is the chest X-ray, and the chest X-ray is given along with the scenario. Then there is an interpretation of that chest X-ray is given. The first one is for brainstorming of the student, that after reading the scenario and watching the investigation, what findings we can see. And then the separate marking and separate explanation of the X-ray is given, and at the below at the end all the findings are summarized in 3 to 4 lines, and then there is the presentation of the chest X-ray, that how you have to present the your findings to the examiner. Then there is a section of questions. These are the SEQs, MCQs based questions, and the options are given. And the good thing about this book is that not only the correct answers are given of the questions, but the explanation of each and every single option is given, that why a particular option is correct and why the others are not correct. For example, if we see the question number 1, that is, which of the following is factor for a primary spontaneous pneumothorax is? Options are male gender, smoking, COPD, trauma, Marfan syndrome. The answer is given. The correct answers are male gender and smoking. And explanation that why question number option number A and B is correct and why others are not correct are also given, and there are also some additional key points given at multiple. So similarly 20 cases are present, and then comes the section of abdominal X-rays. Just like the chest X-ray, in abdominal X-ray, in the chest X-ray, the abdominal X-ray, first of all the introduction is given, that how you have to interpret the abdominal X-ray, normal and abnormal findings, anatomical markings, and different diseases. This is the summary, the different, that how you have to interpret the abdominal X-ray, and these are the clinical cases related to the abdominal X-rays. And similarly, along with the scenario, X-ray is given, and at the next page X-ray is marked, and then summary is given, summary of the findings is given, and then there is a presentation of the findings, and then the section of the question. Similarly, 20 cases are present of the abdominal X-rays. Then comes the section of orthopedic X-ray. There is an introduction, different anatomical and radiological points in identifying the orthopedic X-ray, and after identification and interpretation, there comes the cases, and the 20 cases are present, and they are discussing similarly as we have seen in the chest X-ray and abdominal X-rays. Then comes the portion of the CT scan. With the introduction of the CT scan, the interpretation points, there comes the different diseases, and CT scan presenting different findings in different diseases. Then comes the CT abdomen and pelvis. Then comes the CT colonoscopy. Then comes the MRI scan. And here comes the section of ultrasound scan. Different diseases presenting ultrasounds are given. Then comes the nuclear medicine and different modalities, fluoroscope, fluoroscopy, and here comes the bonus X-rays, CT abdomen, CT MRI, given along with the clinical scenarios and interpretation. So this is the book you must have to improve your clinical skills in interpretation X-ray, whether they are just abdominal, orthopedic, CT scan, MRI, and other modalities of the radiology. So whether you belong to the radiological field, or even if you are a clinician, this is a very best book for improving your clinical skills and